Hello, have you ever been somewhere and then you feel the intense urge suddenly to use the toilet, even though you've gone like 10 minutes before, and when you finally go, it burns? Sometimes it's barely anything coming out, it's just a tiny drop of urine coming out, but the burn is intense. Listen, a lot of people experience it and just brush it off like it's something normal. Even those that experience the burning sensation, they endure the pain and do not do anything about it. That brings us to today's topic: urinary tract infection. Hi guys, Nelia here and welcome back to my YouTube channel. In today's video, we're going to be discussing urinary tract infection, what happens, the signs to watch out for, the prevention, and when to see your doctor. But without wasting much of our time, let's get right into the basics. Urinary tract is a system in the body that consists of the kidney, ureters, the bladder, and the urethra. The kidney is responsible for filtering waste out of the blood, and then the ureters are stool tubes responsible for taking urine from the kidney down to the bladder. The bladder is now where these urine are stored, and the urethra is what's responsible for carrying the urine out of the body. Urinary tract infection now, this happens when a bacteria enters the system and causes an infection. It is that simple as the name implies. And mind you, most times this infection comes from the gut. The bacteria enters the bladder, causes an infection. The most common kind of infection is the lower urinary tract infection. There are literally two types of UTIs. We have the lower UTIs and upper UTIs. The lower UTIs affect the urethra and the bladder, and this is the most common one. Then the second is the upper. This is where the bacteria has now traveled all the way to the kidney. This is usually more severe and require urgent treatment. If not, it comes to more complications. I'm talking traveling all the way to the brain and the spine to cause a septic shock. Why? Because the kidney is connected to other circulations in the body, so it's easy for it to leave there and escalate up to the brain. Here is something a lot of people do not realize. Women get UTIs more often than men. And no, this is not a gender war. It's just basic human anatomy. Women have shorter uretras, and for that reason, the bacteria just have a little distance to travel to cause an infection. As simple as that. How do we know that UTIs? Here are some common signs that you need to watch out for to identify UTIs. The first and most common sign is the burning sensation you feel whenever you pee. The second one is the urge to always want to pee. That's the second sign, the urge to always want to pee. And whenever you go, it's only a tiny drop or nothing at all comes out, and it still burns. Thirdly, you get a dark, cloudy urine, and it is usually with a strong odor. Smelly actually. Also, you might get lower abdominal pain or pelvic pain, and sometimes it radiates to the back. In some severe cases, you might experience blood in your urine, fever, chills, and body ache. At this point now, what will be coming to your mind is, okay, this infection has gone beyond the lower urinary tract and is heading toward the kidney or has reached the kidney, which we call the pyelonephritis. This is a serious condition, okay? It needs urgent emergency care. So what causes this UTI is, first, the most common cause is the bacteria E. coli, and it usually lives in your gut. Here are some habits that might put you at risk to having this condition. First thing first is not taking enough water, because now your kidney has to do extra work to filter waste because you don't have enough water in your system. Secondly, you tend to hold your pee for long hours. This is common among nurses and some other people because you think that you need to do even an extra task, then you postpone going to the toilet because you want to do even an extra task. That is wrong. You need to empty your bladder as soon as you feel it. Thirdly, this one is poor hygiene. So you need to wipe from front to back and not back to front. Next, those of you that finish having sex, it's advisable, especially for the women, always use the toilet after having sexual intercourse. And this is not to prevent pregnancy. This is to flush out any sign of bacteria. It's very helpful. So after any sexual activity, make sure to use the toilet almost immediately. Now, this part is very important and I would like you to pay attention. When should you see a doctor? First and first, I want to bring it to your notice that naturally, when you have this UTI, especially the lower UTI, and you detect it, all you need to do is take enough water and it flushes out from your system. But in a case where a day has passed, 2 days have passed, and this is still there, you need to see a doctor. Secondly, when you start to notice blood in your urine and you start to feel fever or chills, or back pain, you need to see your doctor. And then if you keep getting it repeatedly back to back, you need to see the doctor. Like I said earlier, these UTIs are treatable, and if left untreated, it can travel all the way to the kidney, and that's the most serious problem. Here are simple ways to prevent these UTIs, urinary tract infection. First thing first, you want to take enough water. Drink more water throughout the day. Secondly, you want to wipe from the front to the back, not from the back to the front. Thirdly, do not hold your pee. Whenever you feel like you need to use the toilet, please go and use the toilet. Also, after having sexual intercourse, please use the toilet. Pee after sex. Next, wear loose, breathable cotton fabric underwear and avoid wearing pads for too long. Change your pads at least every 2 to 3 hours and avoid wearing tampons. Avoid overly perfumed stuff in that area and try to use the bathroom every 2 to 3 hours. So my dear viewers, ladies and gentlemen, if you found this video helpful in any way, do not forget to like, share, subscribe and give this video a thumbs up. And I'll see you in my next video.